We know from a variety of community level studies, hospital pre-admission screening, some cohort studies in India, the ONS infection survey, that Omicron comes with a very high prevalence in the community, as high as 10 or 12% of the population shedding virus at any one time. And that's what's driving the incidental hospital admissions and deaths. The challenge as we dig into this is jurisdiction by jurisdiction, the way incidental admissions and deaths are being counted appears to be different. And so at present, we're not able to understand for every jurisdiction this difference. We are starting to compile the data as provided, or the sort of guidance as provided by each jurisdiction. But since we track nearly 400 different jurisdictions, counting the subnational units in many countries, it's going to be quite a task for us to fully understand this, but work in progress. You know, the IHME approach to modeling the epidemic has kept progressing as the epidemic unfolded. And so, you know, our very first model in March of 2020 was really driven by the experience observed in Wuhan and the effect of non-pharmaceutical interventions there on transmission. We then transitioned to a transmission dynamics model with other drivers, mask use, mobility, testing, a bunch of contextual factors such as smoking and air pollution and altitude, population density, and a variety of other factors. And then we had to modify the model to take into account vaccination, and then the spread of variants with the emergence of the Alpha variant. And then finally, the big change that's come in the last few months has been taking into account waning of infection-acquired immunity and waning of vaccine-acquired immunity. So the model, we keep trying to keep abreast of what the virus is showing us and the complexity of what's happening around the world. And I think part of the reason that our out-of-sample predictive validity or model performance has continued to be quite good is because we are trying to essentially keep up with the virus and what we learn about it. Right now, in countries where Omicron is subsiding, there is a pretty rapid move to lifting mandates. We're seeing it in US states, some Canadian provinces, many countries in Europe, and discussion elsewhere of similar moves. And I think those removing the mandates make sense in settings where we think that most people that are susceptible to Omicron have been infected, and the numbers are coming down because we've run out of people to infect. In those settings, the mandates aren't really achieving much at all. And so there should be little to no risk of removing those mandates. In settings, which we don't see a lot of, where there is a lot of behavioral modification, people are avoiding contact, mobility has come way down and mask use has gone up, then perhaps some of the peaks in Omicron may have been before all the people who are susceptible have been infected, and then you might get a secondary resurgence if you take the mandates off. But there's not many places where the other data on mobility and mask use would suggest that's really the driver of the peak, in which case we think removing the mandates will have little to no impact on transmission once you're on the downswing of Omicron. So the big question with Omicron is, what do zero COVID countries, most importantly China, do? And it's really quite a challenge because China, we worry most about people who are unvaccinated and never infected. So there's essentially almost nobody in China who's been infected, except in a very small percent of the population from the original outbreak. And you have quite high vaccination rates, but the vaccine isn't particularly effective against Omicron. It's much worse efficacy than, let's say, Pfizer or Moderna or AstraZeneca. So the challenge that the Chinese government have is, how to manage this situation. If there's a strategy ahead where they can deliver a more effective vaccine booster to the over 65s and under 65s with comorbidities, the vulnerable group, or they can gain access to intellectual property around antivirals and start producing enough antivirals to manage a big caseload, then that becomes a way out. You keep up with these, rolling lockdowns in each place where an Omicron outbreak occurs until you're ready with those other strategies. But if there isn't going to be that strategy, then continuous rolling lockdown, because we expect Omicron will just keep reemerging because it's so infectious, probably becomes infeasible. So I think right now that choice on strategy is probably what the Chinese leadership is trying to figure out. We don't think it's feasible to keep Omicron out of the community for very long, because even the non-pharmaceutical interventions that worked well for Delta, for previous variants, for the ancestral variant, don't work so well for Omicron because it's so transmissible. And so it is going to be difficult, even with lockdown, to keep it under control.